Hi there, I'm Anna Wild, the Birth Whisperer, your guide from a bad birth to a better birth. Thank you so much for taking the time to watch this video. I know you have plenty of other things you could be doing. I value your time and so will make the most of it. This video is made for you if you want to know that your difficult feelings about giving birth are totally normal, if you wonder whether your own birth qualifies as traumatic, even though you and baby may have been physically okay, or maybe you know your birth was really bad and you want to know how to recover. Or perhaps you want to know what defines post-traumatic stress disorder and whether you've got it. Maybe you're curious to learn more about birth trauma in general so that you can feel more informed. Or this video is also for you if you want to get over the guilt and rebond with your baby or child, or if you want to help your baby or child get over their rough entry into the world. So just before we dive in, a little bit more about me. I work with women and couples who want a better birth after a bad birth. I'm a birth skills specialist and a birth trauma therapist, and it is my mission to help women feel confident and safe inside themselves before, during, and after birth, no matter how or where their baby is born, especially when they've had a bad birth before. So I'm a mother of 2 young sons. You can see me here with my family. I'm married to a great husband called Roger, and we live in Nelson, a little town at the top of the South Island in New Zealand. And just before we carry on, a few heartfelt words from me to you. If you have had a bad birth, please know that your emotional response to that really overwhelming situation is totally understandable. Know that you're not alone and you are supported. Childbirth trauma is a really big issue in our society, and thousands of other women know how you feel too. And also, no matter what your inner critic tells you, that it was your fault, your experience was due to so many external forces, and it's not your fault. There is so much you can do to resolve these stuck negative feelings. You can heal, and I want you to know that birth can get a whole lot better. So, first of all, what is birth trauma? The American Psychological Association describes trauma as being often the result of an overwhelming amount of stress that exceeds one's ability to cope or integrate the emotions involved with that experience. So childbirth trauma is a person's emotional response to the distressing birth event. The fundamental point here to know is that birth trauma is defined by your internal feelings about what happened rather than the external facts. Therefore, your experience is completely valid, even if you can mentally tell yourself that your birth was okay, even if you had a vaginal birth or a natural birth and you and your baby were physically fine. Emotionally, you know if something was not okay. Cheryl Beck is an academic, a researcher, and one of the authors of one of the most comprehensive books, research books on the subject, Traumatic Childbirth, from 2013, and she defines birth trauma as an event occurring during the labour and delivery process that involves the actual or perceived serious injury or death to the mother or her infant. The birthing mother can experience intense fear, helplessness, loss of control, horror, and can feel like she's been stripped of her dignity. The founders of birthtalk.org, Melissa and Debbie, explain that a traumatic or bad birth can be difficult, disappointing, or downright traumatic. So it's a pretty broad spectrum of experience. And they also say that the memory can't let you alone, that it stays with you. Sheila Kitzinger, a very well-known social anthropologist and birth specialist, says that when birth is insensitively managed, clock-watched, and interventionist, it can exacerbate existing trauma or simply feel like medical rape. And one final quote here from Cheryl Beck: women who experience trauma were systematically stripped of their protective layers of caring. So what are the 2 things that many women miss out on or lose during a bad birth? Hannah Darlin, who's a professor of midwifery in Australia, says women report having experienced feelings of complete lack of control without the ability to make ongoing informed choices about their care. They recall feeling frightened and vulnerable. So the 2 most crucial factors for a positive birth experience are compassionate support and a sense of control, autonomy, and ownership of the experience. And a traumatic birth can often involve the inverse of these factors. So the number one feature in almost all the stories of women I've personally worked with is that twin combination of a lack of control and a lack of care or mistreatment by staff. So I've worked with many women who've had a traumatic birth, and these are some of the things that they say. I felt powerless, no one supported me, and maybe even my partner or husband. Medical staff were rude and ignored me. They were rough with my baby. I lost control and independence, or the birth was out of control. It's always stories about strange doctors or care providers being very insensitive or unkind in the way that they responded to the situation, and that women feel like they were bossed about by their care providers, that they were at their mercy. Other things include, I can't trust staff, I don't want someone else to be in charge and in control in their next birth. I'm worried that I'll give my power away at the next birth. I was helpless, I'd been left there to die. I felt degraded, pushed aside, ignored, disrespected, not listened to. And the doctors talked about me or above me as if I wasn't there. I became a body, not a person. So there was a systematic review of 137 reports of factors influencing a woman's evaluation of their childbirth experiences in 2004. And this report showed that support in labour and listening to a woman's own issues is most likely underestimated compared to other less effective established methods to improve women's birth experience, including childbirth education and obstetric analgesia. So this means that even though women may have gone to an antenatal class and they have an epidural, that when they're supported and listened to, that those things are more powerful in having a better birth experience than education like antenatal classes and epidurals. So how common is birth trauma? It occurs for anywhere between 6 and 35% of women who give birth, depending on which research you look at. I'd say most authorities I've looked at agree that the true figure is somewhere between 25 and 35%. And when I share these statistics with mothers, they're usually really surprised and think it is probably even higher than that. In some ways, it's hard to know how common birth trauma is, as many women do not get help or share their feelings, and possibly they consider that their experience was bad, but maybe birth is always bad, or they just don't know where to go, don't know what to do, and just get on with life as best they can. And two studies from 2006 show that anywhere between 1.5% and 5.6% of women experience full-blown post-traumatic stress disorder, and we'll go into that in a moment. So just before we do go into post-traumatic stress disorder, there can be some confusion about the difference between postnatal depression and post-traumatic stress disorder. So just a little bit about that. 50% of women with birth trauma experience symptoms of depression, and often women are diagnosed with postnatal depression when actually post-traumatic stress disorder is part of the issue or an underlying or additional issue. So common postnatal depression symptoms include feeling persistently down and sad, and a lack of pleasure, fatigue, and low confidence. But when you add post-traumatic stress disorder, the experience of a really traumatic birth, into the mix, then there are a whole host of other feelings. What is postnatal post-traumatic stress disorder? It's a psychological condition outlined according to criteria in the official catalogue of psychological disorders, the DSM. And so to officially qualify for this diagnosis, you will need to see your doctor and get a referral to a psychiatrist or psychologist. So diagnosis will include several of the following points. There are 4 areas that the diagnosis goes into, and the first one is the traumatic experience itself, so that you experience an event that seemed life-threatening to you or your baby. You may have flashbacks, memories, nightmares, and strong feelings about the event, and or the inability to recall an important aspect of the event. The next area is avoidance of reminders of the traumatic event, like conversations about birth, places, for example, hospital, people, like care providers. You may find birthdays and anniversaries of the event really challenging, and there may be some emotional numbness and bonding issues with baby. Also mood. This covers a wide range of negative feelings, including feeling detached or estranged from other people or being unable to have loving feelings, and you may also have feelings of blame towards self and others. And the final category is arousal, so feeling a bit wired, hypervigilant, on guard, difficulty sleeping and being easily startled. You may also experience irritability, outbursts of anger, or a desire to get even. And there might be intense stress or reactivity at exposure to events similar in some way to the traumatic event, including panic attacks, sweating, and palpitations. So many women may never get an official diagnosis of post-traumatic stress disorder, but still be experiencing symptoms of birth trauma, and others, including fear of birthing again and therefore avoiding pregnancy, a roller coaster of emotions that just seem over the top, distrust of authority figures and institutions, hypersensitivity to injustice. You may have issues with sex, feelings and flashbacks, feelings of guilt about the birth and towards baby. There may be sometimes a feeling of frustration towards baby or an overprotectiveness of baby, so terrified of separation from them. There can be also relationship problems as a result of symptoms. You may find examinations really stressful, and again there might be flashbacks to memories like smear when you have a smear or some sort of examination with your doctor. You may feel flat or down, and remember there that approximately 50% of women who suffer from birth trauma also experience postnatal depression. And sometimes you cope using addictive behaviours. Penny Simpkin, who's a birth researcher and doula, says that the birth memory will be vivid and deeply felt and may influence how you think about yourself and birth generally, and that's whether it's positive or negative. Symptoms can last a lifetime unless you find ways to heal. So let's go into how can you feel better. First of all, find out more about your birth. This can be scary, and you may find you want to avoid delving into what actually happened until you've done some emotional healing or some resolution first. But if and when you're ready to, then get your records from your birthplace or your care provider, or maybe you'll already have them. And once you have your records, ask a midwife or another professional to explain them to you. Then you can choose to write a letter voicing your concerns or complaints, even if you don't send it. The next area is really about acknowledging your own perception as valid and really looking after yourself. And just remember that no matter what happened or what others tell you, to really acknowledge your emotional experience as important, that it matters and that you deserve to be heard. And this step of saying, actually, that wasn't okay, is the first step towards healing. Just know that you did your best that you could at the time with the resources that you had available to you at the time, and it is so not your fault. So that leads into just be kind to yourself. Be kind to yourself as if you're looking after your very own friend. Like, what would you recommend to them? Admit vulnerability, so tell people if you're having a hard time, and do ask for help, whether it be with childcare, with housework, or just to get some breathing space. Exercise when and if possible, so walk with baby or ask someone to mind your baby and just get out. I know for me, getting up high on the hills always helps when I'm in a flat space. And put it on your calendar to make exercise a priority. And or gentle yoga or other movement and breathing based mind-body exercises can be really stabilizing, calming and healing. So you may even prefer to do yoga or some other type of more gentle movement to more vigorous exercise. Book in some body work or massage. Shiatsu is really great, craniosacral therapy is fantastic, or just ask a friend for a shoulder rub, or you can swap foot rubs with a friend. This is really wonderful, not only for your sense of stability and inner calm and just for soothing the nervous system, but great for friendship as well. Do share and talk with people who will listen non-judgmentally. Talking a lot can help. And then get support. Please do talk to your doctor or care provider or someone if you feel like those symptoms that you're experiencing are overwhelming, and you may need a referral to just get you back into a place of some reasonable stability. Or you may choose to work through stuck, painful feelings in your own time through art, music, dance, meditation, journaling, prayer. And this do-it-yourself method is really effective if you've already done some personal healing work and feel really confident with touching difficult emotional material. But if you haven't, I really recommend that you work with a therapist or a specialist. And as I said, if your current symptoms are overwhelming, then do see your doctor and get a referral to a specialist psychologist or psychiatrist who has experience in working with trauma. So you might like to seek out an awesome other person to be your guide or support person or therapist, and there are lots of ways you can do this, whether it's an official therapist or you find a counsellor in your area. You might find someone in your church who you can pray with, talk to a meditation teacher, just ask around. Or again, your doctor or care provider may know a practitioner who's got a really good reputation, whether it be conventional or alternative practitioner. And if you do decide to see a therapist, make sure you find a professional with experience in this area of trauma, particularly birth trauma if possible, someone who really gets results. So will they support you to make emotional shifts as quickly and easily as possible? So you'll need to ask some questions about their experience or talk to other people who've been to see them. And if you find someone who's not quite right for you, then do change. Or if you're not getting the results you want, then do find someone else. Some of the modalities that I've found really good for healing trauma are the journey, EFT and other tapping therapies, matrix re-imprinting, birth into being, NLP, TRE and hypnotherapy. But in the end it really comes down to the skill of the individual practitioner. And research also shows that cognitive behavioural therapy can be effective for birth trauma. So talk to your doctor, talk to a therapist, talk with your friends, talk with people in your community and evaluate your options and make a choice. Another option is to book a session with me. I'd be really happy to work with you. What can you do to feel better?
What else can you do to feel better?
You can rebonding with baby can really help you. To continue, rather, you can rebond with your baby.
At any age,
rebonding can happen at any age, so recognise that you always
have
have the best to help you mend the feeling that you didn't get to connect with them at birth and recreate that connection. And supporting baby to heal will also help that feeling of bonding to grow. So how can you help your baby to heal? I think it's important to know that baby does feel birth and they do have an experience of birth, and it might not have been perfect or fantastic, but that they can also heal. And one thing you can do to support their healing is start with healing yourself, because the way you respond to the challenge of a traumatic birth does impact your baby. For example, if you carry around all that guilt and anger and grief and those negative feelings for years and years, then on some level your baby will sense this. I think we human beings, we're so sensitive to feelings around us, and children and babies are no different, perhaps even more perceptive. And by healing your own response to birth and feeling more okay about what happened will help baby to feel okay too. Now this is totally different from saying that what happened was okay, because it wasn't. But the example of transforming your emotional response to that hard life experience is an example of skillful parenting in action. So if you choose to heal, then your baby or child also absorbs your confidence and observes you modelling that personal healing behaviour, and I think will therefore have a greater potential to heal too. Really, you're giving your child tools for life. On a very practical level, soon after birth, if this is possible, or even a bit later, take your baby for a craniosacral treatment. One craniosacral therapist, Janine Blanchard, who has a very special interest working with newborns, says this. She says craniosacral therapy corrects the initial traumas the body innocently embraced, and in this way baby's sense of presence is strong and healthy again, and they'll no longer operate in the fear state. And by establishing proper states in the body, old unhealthy patterns that may have been established in that birth will fade, and the infant is set to welcome new experiences and opportunities for growth and love. Another thing that's really helpful that is snuggling baby or your child close to you when you can, even if you're faking it a little bit. So it's okay if it doesn't come naturally, just hold them in your arms, look into their eyes, talk to them. Additionally to this, you can play birth with your little one. This might sound a little weird at first or a bit silly, but many mothers have found this game really helpful. I read about this in an article on Midwifery Today about healing birth trauma. In that article, Jennifer Grebenow and Nancy Weiner suggest that you play birth with your little or older child, and that you snuggle your baby or toddler up in a big soft blanket that cocoons them close to you and talk them through a better birth experience. And it's sort of like just mummy baby talk, just play along. And when it's time for your baby to be born, then open the robe and say to your child just what you'd like to have said to him or her at the birth. And Jennifer explains that by doing this and cuddling her caesarean born son, she'd sometimes just lapse into baby talk and mother talk just unintentionally. And I know that for myself, my second son has played a similar game for quite a long time, snuggling up in my dressing gown and asking me to be pregnant and then birthing himself out of my dressing gown spontaneously. He just loves that game. If that's not your idea of something good to do, then you can also talk to your baby when they're asleep. So just sit by your child at night when they're asleep and tell them what you felt bad about, what you feel bad about, how much you love them, and everything else that just comes into your mind and heart. And in my experience, this is fantastic for all mother guilts. And also know that your child is on their own healing journey and that none of us are unscarred by life. Life can be pretty rough at times, and we're all personally responsible for resolving old patterns and trauma that don't serve us. It's really hard as a mother because we all want to prevent pain and suffering for our kids, and we feel guilty and responsible when difficult things happen. Please just give it up whenever you can, and just know all you can do is be as kind and loving as best you can at any one time, and trust your own child to heal their own stuff. And if you have a faith, then of course you can just give it up to God to heal. It's never too late for your baby to heal if they have a trauma left from how they entered the world. I've worked with adults healing their own birth experiences in really short, effective sessions, and there are many therapists who do this worldwide. And like all early memories, it's not about remembering what actually happened, because we might never know. It's more about healing any feelings and associated core beliefs that arise. And so your child will always have the capacity to deal with anything that's left over from their birth, and they will certainly have had a totally loving, caring mum. So thank you so much for watching. If you have experienced a bad birth and you may wish to have another baby, or if you're pregnant now, what's the next step to a better birth? Find out how to regain your courage and feel better about birthing again by signing up to grab my free report just below here. Pop your name and email address in. It's called The 6 Secrets to Having a Better Birth After a Bad One. Essential choices to restore confidence so you can birth again. Really excited to keep in touch with you, so do enter your name and email in below, and we'll catch up again soon.